particular technique is knowing how to manage a seizure type of situation. For this purposes, we're just using this mannequin here who is actively seizing. In that particular situation, the whole body most likely is going to be convulsing. Ideally, you would know that they've got a seizure disorder through a couple different methods. One, they previously disclosed that, and two is they have a medical alert ID tag that is indicated that they do have a seizure disorder, so that indicates that there's a reason for this particular seizure. If you do not know exactly what's causing the seizure or know that they have a pre-existing condition, that would probably necessitate a call for 911 immediately. But in this particular situation, we know he's got a seizure disorder, and so we just want to manage it and know that hopefully within about 5 minutes, the seizure is going to resolve itself. If it lasts longer than 5 minutes, then it's also a call for 911. While he's seizing, one of the things that we want to make sure is that there's nothing around as he's seizing that can cause any damage. We don't want to hold him down or restrict him in any way, but if his head is bouncing up and down and he's hitting the floor, we might want to place a towel or help hold and protect his head from going down. If his arms are going and hitting into any type of obstruction, make sure that you clear the area. Just give that individual as much space as you possibly can for the seizing to be able to kind of stop and resolve itself on its own. Many individuals have medication that you can give to them while they're seizing. As long as you're prescribed and directed to do so, that's totally fine. Once the seizure resolves itself, then what we want to do is we just want to calm, reassure the individual. You might want to check to see if there's any spinal trauma as a result of the seizure, and if that's the case, you want to measure that. They might be unconscious for a little while after the seizure has taken place. So what you want to do is that you want to just roll them and put them in the hands position, which means that they're going to be rolling on their side with their legs bent up. So it's just a nice neutral position for them to be able to kind of stay unconscious. This allows their tongue to go down in front of their mouth, so that way they can maintain their breathing. So it's just a good, nice, comfortable recovery position for them to be in. Otherwise, you just want to make sure that you monitor. Again, if there's any problems, call 911. You want to check to make sure you know how long the seizure lasted. So again, if EMS comes, you can tell them this was a 7-minute seizure, this was a 10-minute seizure. That definitely provides indications of what might possibly be going on. Otherwise, you just want to make sure that you manage anything that might come as a result of that.